We will now have a 10-minute Q&A session and ask Dr. Delorne to return to the stage. And again, there's a microphone in the center aisle for anyone in the audience who has a question or a comment. Please go ahead.
Good afternoon. Thank you for the presentations. We know how difficult it is to publish any psych or spirituality, scientific work in the current academic environment all over the world. To throw a little more send to it, Chico Xavier said the telephone rings from up to here, not the other way. So that makes it more difficult to have the spirits at our disposal for any time of research. My question is, doesn't it make more sense for us to create our own venues to publish? In other words, to create our own, like the Noetic Science, and to create our own scientific journals, such as, I think, the Explorer is one here in the United States, but other venues, and detach ourselves from the classic reductionistic academic environment of universities.
There are tons of journals, on parapsychology. The Journal of Parapsychology, and Gary would know better. But so there's a lot of journals you can publish in if you want to in parapsychology. It's just, mainstream people won't read it for sure. So these journals exist already.
May I speak in Portuguese? Eu creio que
I believe that one of the challenges that was mentioned for us, even in the academic area, which is extremely materialistic and resistant in this environment, as they keep us and they don't expel us. There's a very disagreeable experience we may have had in this area. We still insist, and I have tried the academic area after having today live from my medical practice. For me, it's interesting to be in the academic area, but if I am expelled, I can still survive and keep my home. I think it's extremely courageous on the part of those who do research in the University of Juiz de Fora. Giancarlo is in, is Dr. Alexandre Moreira Almeida. We have great people in this research group about spirituality and health at the University of Juiz de Fora. They're very courageous because they're academics, they're professors, as their first option in life. And what they receive in terms of criticism is very great. But they have published in very good journals. And if we are not able to have publication in the highest impact journals, but I think the paradigm is going to be broken. It's important for people to immortalize for the students of medicine what has been done. Today, the only vehicles are the scientific journals, right? That's the way that we have. And I think it's the way to break down the paradigms also, this old paradigm, and to put in a new one.
Good afternoon. Great lectures. Thank you. I was just wondering, you briefly mentioned the beta, alpha, theta, delta brainwaves and how you were wiring the medium's brain to record that. Did you find that an accurate medium accessed maybe a theta wave more often than a different wave?
Yeah, so in the results I showed, it was one specific medium that used, like we had this frontal midline theta rhythm. And so we did find that in that specific medium, which is why we want to retest her to see if we'll find that again. We found other things in other mediums, which I didn't show here. You can look at the paper if you want. But it's not, let's say, consistent. All the mediums will show specifically that effect.
Any other questions or comments from the audience? Either of the speakers have any other additional comments they would like to make?
Well, I'd like to know about Dr. Jorge methodology, but I'll ask him after.
You can ask now because we still have time.
Well, I think, you know, he discussed with his wife for 2 hours and then they went to bed. And so, yeah, maybe, yeah.
I have a question. I thought that in Brazil, Spiritism is
How about the
part of med
microphone,
schools.
Please speak.
Can you speak up to the microphone? Sorry. Thank you.
Hi, my name is Marta Mondino. I'm a physician here in this area. I'm an anesthesiologist as well, like this gentleman who gave such a beautiful lecture. My question is in regards to how to initiate the education of the med students. So ideally, this subject should be at some level in med schools. Is this available in Brazil since there is so much influence and so much knowledge about this already in med schools? Are they teaching spiritualism as a subject or as a course or as a workshop or things like that? Because that's where the young brains are who can then continue this on.
I wonder if you mind if I ask for Dr. Lucchetti to answer this question, because he conducted a great study between medical students in Brazil, and he published the paper, the SBRAMI study, and is a reference paper in medical education.
Well, regarding medical education, we have carried out 2 studies. The first one is mapping how many disciplines or courses of spirituality and health we have in Brazil. It's approximately 11% of the schools have such courses. Yeah, but it's not very good because here in the US, we have more than 95% of universities. That's Harold Koenig has carried out a research showing that. But at least 50% of the universities have a content of spirituality and health, not courses, but some kind of content, so half of the universities. And we have carried out a study about the opinions of the medical students about spirituality and health with a collaboration with the Duke University of Harold Koenig. And we found that the students believe this is important, believe that spirituality can have an impact on the health, mental health and physical health of patients. They want to address that, but they don't know how. They are not trained to address these issues. But here in the US, we are doing some partnerships, especially with Harold Koenig and with Christina Puchalski from the George Washington University. That's, I believe, in medical education and spirituality, the most important person in the world about that. So I think you are here, you have some very good researchers and very good educators regarding this issue. But we are trying to improve this teaching of spirituality in Brazilian medical schools.
Any other questions or comments? Oh, please go ahead.
I just want to make a quick comment that it's very important that we are teaching this in the schools, but we also need a change in the healthcare system to accommodate the approach of spirituality in medicine. We still don't have that properly done.
I'd like to address another comment. I work in a Spiritist hospital in my city, psychiatric hospital, and we have some difficulty to talk with our colleagues about the results of the disobsession, the spirit release therapy, about what we saw, what we produced with mediums, the reports of mediums about the patient, the reports of the deceased people related to that patient. Our colleagues, most of them spiritists or believers in any form of life after death, but they just talk, oh, it's no problem. I'll give to him another medication, he will be fine. And it's very difficult. We have to change a lot of things. You're right, Sonia. We have many jobs to do.
Anyone else with a question, comment, curiosity? Please go ahead to the microphone so that your question can be recorded.
No,
Well, we need to capture it on the recording. Thank you very much.
That's our web.
Thank you. Oh, yes. Okay, I'm Elizabeth. I'm a medium. And I'm wondering, how do you choose the mediums for your studies? It's just interesting, like, do you just randomly pluck them off the internet, or is it word of mouth, or?
Well, we used Gary's medium, kind of. So you can ask him the question. But basically, we work with Judy Beischel, who was Gary's PhD student, and they have a special procedure to select the mediums where they train them. At least now, they train them on 8 different topics. Maybe you can answer that, Gary. How do you choose your medium?
Yes, in our research, initially, we didn't have any formal procedure. People would come to us, and then we would test them with specific people to see whether they could get accurate information. But over time, it evolved, and we ended up developing almost a credentialing procedure, which is now turned into a formal one at the Windbridge Institute that Julie Beischel then developed. And part of the reason for doing that was not only to have some objective criteria that the medium was able to receive enough accurate information as to make it worthwhile from a scientific point of view, but also to make sure that these individuals understood the constraints and the responsibilities of doing science within a university setting, what human ethics was all about, the kinds of concerns you have for protecting the rights of sitters, of, quote, subjects, anonymity, and so on. And I think on the whole, then everybody felt like we were more part of a team because it was a real research collaboration.
The mediums. In Brazil, we have a fabric of mediums. We have mediums for, it's easy because Spiritism is very accepted. In our spirit centers, we have a lot of mediums. In the college where I teach, last week, one of the students asked to me, how can I do with a man that appeared to me every night? His name is Leonardo. He has 21 years old, and he died in a city near my city by a gunshot. Am I crazy or am I medium? Like this one, we have a lot in Brazil because the social acceptance is high. Then the selection of mediums to work in this obsession, for example, is not any medium. You have to train them and about some years after they joined the group, they can produce very well. But the Spiritism accept mediums. In Brazil, the Protestant religion, we have mediums too, and they can work as mediums, and we can talk to them naturally. I have a patient. She is Protestant. She's leader of the religion, and in occasion she was at my office, and she told to me, "I'm seeing an angel, but wow, it's a different angel. He is bald, he's barbed." And I turned to her side the picture of Dr. Bezerra de Menezes. And she was livid, white, and, "Oh, it's the angel." And I thought, well, it's the spirit, Bezerra de Menezes. And she told to me, "It's an angel." And I thought, it's okay. But in Brazil, we have, I think that in America, it's not difficult to. It was, to my surprise, in Finland, they have a lot of mediums. They are very shy to say that they are mediums. But after our lecture, I and Giancarlo went to Finland last year. But after the lectures, a lot of mediums came to us and told to us, "Well, I enter in contact with the spirits. I'm a medium. I have shamanic powers." Then I think that it's very interesting to study, specific to study. Those mediums are experienced, have experience in psychography for a long time. They are 4 mediums with a large experience, and they are recognized. 2 of them are working more than 30 years. Then the selection is, the first criteria was the proximity of the investigators in the area of where the investigators live. The second is the experience. And the third, the confiability about fraud. We should be sure that the possibility of fraud is very low. Then we select in this criteria. The first one was the proximity. Then we have 4 great mediums that will work with us.
Okay, any other final comments or questions? Very good. We are going to have a short break.